Hello, my name is Gabriela Baers. I am a veterinary radiologist and a part of the Orthopedic Foundation for Animals, or the OFA. The OFA is a nonprofit organization that serves as a databank and health information center with the long-term goal of reducing genetic diseases. Today I will be speaking on behalf of the OFA by going through proper positioning techniques and guidelines for obtaining pelvic radiographs for hip dysplasia evaluation. As a disclaimer, there are no conflicts of interest in giving this webinar. Proper patient positioning is vital in veterinary medicine for appropriate image evaluation. This is important for all imaging studies, regardless of the region of interest. A couple notes on this. The term radiograph refers to an X-ray image. In this case, the patient refers to a dog. However, these positioning tips do apply to cats as well. And finally, image orientation. In an X-ray image, the patient's right is displayed on the left side of the screen, whereas the patient's left is seen on the right. Therefore, when we are talking about the right hip, we should be looking at the left side of the screen. So, why are radiographs so important? Radiographs of the hips, in particular, are useful for a variety of different reasons, ranging from trauma to evaluation of hip pain or difficulty rising. Without proper positioning, the likelihood of missing a lesion or diagnosis increases. With poor positioning, dogs that may have normal hips can be misdiagnosed with hip dysplasia, as they may demonstrate similar attributes such as decreased coverage of the femoral heads or an abnormal appearance of the femoral necks. Today, the primary focus will be on radiographs intended for hip dysplasia evaluation. However, these positioning tips are applicable to all pelvic radiographs. In general, pelvic radiographs should include a ventrodorsal as well as a lateral projection. However, for evaluation of the hips for screening through the OFA, only a ventrodorsal projection is required. As such, the focus for positioning today will be on the ventrodorsal view. This leads us to screening through the OFA. This is not the only screening method available for dogs, however, this is where our focus will be in this webinar. The OFA's mission statement is to improve the health and well-being of companion animals through a reduction in the incidence of genetic disease. This involves the screening and evaluation of dogs for a variety of genetic diseases, ranging from cardiac disease to elbow dysplasia, in order to provide owners and breeders with more information. This, in turn, allows breeders to select dogs that may be the best candidates for their programs. One of the most common screening tests that is performed is for canine hip dysplasia. For evaluation through the OFA, a single radiographic projection, a ventrodorsal view, of the pelvis is required. If the dog is under 24 months of age, a preliminary evaluation is performed by a single board-certified radiologist. If the dog is over 24 months of age, this radiograph is submitted to a panel of 3 radiologists for independent evaluation and grading. The average grade is then accepted as the dog's final score. This 24-month cutoff is selected as the age for evaluation because it provides a higher likelihood of being able to diagnose a dog accurately with dysplastic changes. There is a study by Corley et al. That shows that the correct diagnosis of dysplastic or non-dysplastic is able to be reached in approximately 95% of dogs at 24 months of age. Of course, dogs may also be evaluated and may receive certification at any point after this 24-month time period as well. Grading of hips is categorized into normal, which ranges from excellent, good, or fair, borderline, in which no consensus is reached and resubmission is recommended, or dysplastic, ranging from mild, moderate, to severe. This is based on confirmation and evidence of any subluxation or hip laxity or degenerative changes. Within 2021, over 46,000 dogs had evaluations for hip dysplasia. Challenges that may prevent evaluation include poor radiographic technique, excessive image artifacts, and poor positioning. We can see in these images that the hips cannot even be seen clearly, and therefore cannot be evaluated to give the dog an accurate grade. With the increasing use of digital radiography over film, and with improvements in digital imaging systems, technique and artifacts less often pose significant barriers in preventing evaluation of the hips. Suboptimal positioning is far more common, though only a small number are sent back due to complete inability to evaluate the image. Not every image with rotation is rejected, as this does cause significant impact to the owner and to the clinic in which the image was acquired. Small amounts of rotation can be taken into consideration when evaluating the image. However, appropriate positioning is vital to ensure that the dog is receiving an accurate grade. If the patient is rotated, this provides a risk for a false decrease in the dog's grade. So, how can we best position the patient to ensure that we are getting the most accurate representation of the dog's hips? First, let's discuss positioning aids. The first part that must be addressed is the issue of chemical versus physical restraint. This refers to whether the dog is entirely awake versus under some degree of sedation or anesthesia. Chemical restraint is not required for evaluation. However, the recommendation from the OFA is that the dog is sedated or anesthetized to the point of muscular relaxation. This allows for proper positioning of the patient, which in turn provides the best chance of the dog receiving the most representative grade. You can imagine that taking images of the dog on the right here, as a young, energetic, and potentially nervous puppy, would be much more difficult while awake and wiggling than if he were sedated. The likelihood of needing retake images due to positioning problems would also be higher while awake, with more difficulty in being able to reposition the patient. Physical versus chemical restraint is something that the OFA has been tracking for several years and will begin reporting in the dog's OFA number. Additional tools include physical positioning devices. This includes the use of troughs, wedges, pads, and sandbags where appropriate. These can more easily be used in dogs that have been sedated or anesthetized and may be patient-dependent, as each dog's specific conformation will require different needs. A narrow, deep-chested breed, such as a German Shepherd, may require more positioning devices, such as a trough and wedges, than would a small, broad dog, such as a French Bulldog. Next is how to position the dog for success. The dog should be placed in dorsal recumbency. The pelvic limbs should be extended and parallel to one another and to the table, and the limbs rotated slightly internally in order to straighten the limbs. While not in the image, rotation of the thorax and cranial half of the patient will create more difficulties in trying to obtain straight images of the pelvis, so it is advisable to keep the entire patient as straight as possible in dorsal recumbency. Applying some traction to the thoracic limbs will improve the straightness of the remainder of the patient. This image is of a dog that is properly positioned on the table and ready for imaging. The field of view should be collimated to extend from the wings of the ilium to the stifles, as is seen on the image on the right. Once the image has been acquired, the next step is to evaluate the image and to determine whether the image is well positioned and ready for submission, or whether the patient needs to be adjusted and images retaken. So what do we look for to ensure that the pelvis is straight on radiographs? First, we want to ensure that the necessary anatomic structures are included and that the field of view is appropriate. This means that the image should extend from the cranial aspect of the ilial wings to the level of the stifles, as indicated by the orange lines in the image on the left. A field of view that is too large, such as in the radiograph on the right, unnecessarily increases patient radiation dose and reduces image quality. On the other hand, too small a field of view, as seen on the left, can also hamper evaluation. If the dog is too large to include the entirety of these structures within one image, such as with Great Danes, Newfoundlands, or Mastiffs, it is better to collimate out a portion of the stifles rather than the ilium or sacrum. Once the images have been evaluated for field of view, then we can begin to assess positioning. First is to assess the positioning of the pelvis. Begin by looking for symmetry of the obturator foramen, circled in blue, and the ilial wings, which is indicated by the dark orange arrows. These should be symmetric, as is seen in this radiograph. The pubis, ischial spines, and ischium should also be symmetric. The acetabulum themselves may differ in appearance, particularly if there is unilateral pathology, so reliance on the symmetry of acetabular coverage of the femoral heads is not advised. The obturator foramen and ilial wings are the most commonly used and the most reliable for evaluation of straightness of the pelvis. If there is a discrepancy in size or shape of the foramen, or if the ilial wings do not look similar, this is an indication that the pelvis is rotated. Once the pelvis has been evaluated, the remainder of the dog's positioning should be considered. When the dog is properly positioned, the vertebral column should also be straight. The spinous processes should be aligned with the center of the vertebral bodies from L7 to the cranial extent of the images. This is indicated by the yellow arrow in this dog. The pelvic limbs should be parallel to the table. This means that they should be symmetric on the image as well, extending straight towards the caudal extent of the image. This is demonstrated on this image by the blue lines. The ischial tuberosity, indicated by the red arrow, is seen to overlie a portion of the femurs. This is symmetric for both the right and left limbs. The patellas should be seen centered over the distal femoral metaphysis, as indicated by the red circles. When the femurs are straight, the fibula will also be seen in appropriate positions overlying the medial and lateral aspects of the distal femur. Too much external rotation of the pelvic limbs will result in the patellas appearing to be located lateral to the femurs. Too much internal rotation will result in the patellas appearing to be located medial to the femurs. This can sometimes be mistaken for patellar luxation, when it is in fact due to positioning of the limbs. In males, the os penis should be seen centered over the caudal vertebrae and sacrum. The radiograph on the right demonstrates good positioning with the os penis centered over the vertebral column. If the os penis is seen off to the right or left of this, as is seen in the radiograph on the left, that is a good indication to double-check the dog's positioning and re-evaluate the remainder of the image for positioning, as he is likely rotated. The os penis is indicated by the blue arrows, whereas the red arrow indicates the vertebral column in this patient. There are times when frog leg views are necessary for full evaluation of the patient, particularly in cases of trauma. However, this drastically alters the appearance of the hips and changes the portion of the femoral heads and necks that can be evaluated, and therefore is not appropriate for submission for hip dysplasia evaluation. Other important image considerations include markers, text, and radiation safety. It may seem obvious, but it is important to ensure that the markers and text or patient ID are not overlying any anatomy, as is seen in the image on the right. Left and right markers are also important to include in the image. Occasionally, dogs may only have one abnormal hip, or may have had prior trauma that has been documented, and so it is important to know which hip has been affected in these cases. Appropriate ALARA practices should also be followed at all times. This includes appropriate shielding of personnel, limiting number of retake images, and keeping human anatomy out of the primary beam. So let's take a look at some common positioning mistakes. The most common mistakes include transitional vertebrae, or relying on the vertebrae alone to determine straightness, pelvic limb rotation, or pelvic rotation. Let's start out with looking at transitional vertebrae. Transitional vertebrae pose a unique complication with positioning. Transitional vertebrae, L7 in particular, have a significant range in appearance. Sometimes the transverse process or processes of L7 will be fused with the ilium. In these cases, straightness of the vertebral column does not ensure that there is straightness of the pelvis, so particular care should be taken to ensure that the pelvis is properly positioned, rather than relying solely on the vertebral column. In this patient, both the left and right transverse processes of L7 are fused to the ilium. In this particular case, the patient's spine is straight and the pelvis is straight. When there is unilateral pathology, as in this case, straightness can be more difficult to achieve. In contrast, this patient only has one transverse process that is fused with the ilium. This is creating asymmetry of the vertebral column in relation to the pelvis. While the pelvis is relatively straight, as indicated by relative symmetry of the obturator foramen and ilial wings, indicated in blue, the spinous processes of the caudal lumbar vertebral column are off-center and are located towards the right of the vertebral body. In these cases, it is more important to evaluate the positioning of the pelvis and the straightness of the pelvis rather than relying solely on the vertebral column. In this example, we can see that, again, there is a transitional vertebrae of L7. In this case, the spinous processes are located once again towards the right of the patient. Had we been relying solely on the vertebral column to position this patient, we might have overcorrected for rotation. However, when looking at the obturator foramen, which are indicated by the blue arrows, we can see that those are symmetric, and therefore the pelvis is straight. This particular dog does, however, have one of the other more common positioning mistakes, which is over-rotation of the limbs. This is identified by noting the inward angle of the limb, which should be parallel straight lines, and by the medial positioning of the patella. There is misconception that over-rotation of the limbs may help to improve the dog's grade. However, as we can see in this image, this does not hide subluxation of the joints, which is indicated by the yellow arrow. Any degenerative changes, such as sclerosis or osteophytosis, will also not change appearance, so this will not result in a change in the dog's grade. Under-rotation of the pelvic limbs results in a partial frog-legged view. This may alter the way that the femoral head and neck appear in the image and prevents proper assessment of the femoral heads and necks for evidence of secondary degenerative changes. Once again, the angle of the limb does not align with the ideal parallel limb positioning, and in this case the patella is seen lateral to the femur. Both over and under rotation of the limbs are often accompanied by flexion of the limbs. Flexion of the hips and stifles may also alter the way that the femoral head sits within the acetabulum, and once again will change the appearance of the femoral heads and necks, therefore limiting evaluation. And of course, one of the most commonly seen mistakes is simple rotation of the pelvis. We can see in these images that the obturator foramen and ilial wings are not symmetric. the ischiatic tuberosity also do not cover the same amount of area on the femurs, despite the femurs being parallel to each other with well-centered patellas. The os penis in this patient is also displaced towards the left of the patient. The larger obturator foramen is the one which is farther away from the table, and that side should be slightly shifted towards the table when repositioning the patient. This particular patient is rotated towards the left. Once the images have been properly analyzed and are deemed acceptable, they can then be interpreted and submitted for evaluation. So let's take a look at some examples of how positioning can influence the dog's grade. These images are from the same dog on different days. The original radiograph is seen on the left and the retake radiograph on the right. The original radiograph was rejected by the radiologist due to inability to evaluate the pelvis due to degree of rotation. If we look at the image on the left, we can see a significant difference in the symmetry of ilial wings and the obturator foramen, with the right obturator foramen being larger and the left ilial wing wider. The os penis is displaced to the left of the vertebral column. The spinous processes are located to the right of the center of the vertebral bodies. The pelvic limbs are parallel, with the patellas centered over the femur. However, we can see that there is a slight size difference between the femoral heads and necks, with the right slightly larger than the left. All of these findings are consistent with rotation of the dog towards the left. Because of this rotation, the acetabulum looks as though it does not provide adequate coverage of the left femoral head, while the right acetabulum has more than enough coverage. These are demonstrated by the red arrows. It also may look as though the left pelvic limb has less muscle volume than the right. On retake radiographs, the positioning of the dog has improved. The obturator foramen are closer in symmetry. This is still not 100% perfect, as the right obturator foramen is still very slightly larger than the left, indicating that the dog is still very slightly rotated towards the left. However, the spinous processes and os penis are in better alignment with the vertebral column. The difference that this makes on the coverage of the femoral heads by the acetabulum is huge. The asymmetry of the pelvic limb musculature is also no longer seen. This dog received a final grade of good. This is an example of a dog that received an abnormal grade, or a grade of mild hip dysplasia, on first submission, but passed with retake radiographs. On the original image on the left, there is a notable difference in the size and shape of the obturator foramen and an asymmetry of the ilial wings. The spinous processes are slightly to the right of midline on the vertebral bodies, and the os penis is slightly to the left of the vertebral column. The patella are well centered on the femurs, though the left pelvic limb is slightly medially angled. Similar to the previous example, this dog is rotated towards the left, though to a lesser degree. This is resulting in an artificial decrease in coverage of the left femoral head, making it appear as though the left acetabulum is shallow. This led to an abnormal grade of mild hip dysplasia. On retake radiographs, the obturator foramen and ilial wings are improved in symmetry. The os penis is centered over the vertebral column. The spinous processes are very slightly left of midline. The stifles and patella are not included in this particular image. While the radiographic technique is not ideal, and there is overexposure of the image, the positioning of the patient has improved and the coverage of the femoral heads is better able to be evaluated. Even such a small degree of rotation has resulted in a significant difference in grade for the dog, so it is important to really take the time to double-check that the positioning is optimal and to set the dog up for success. Similarly, this third example is of a patient that initially received an abnormal grade and passed with normal hips on resubmission with retake radiographs. On the initial radiograph, there is very mild asymmetry of the obturator foramen and ilial wings. The os penis and spinous processes are fairly central in location. The limbs, however, are externally rotated, as is seen with the lateral location of the patellas. The limbs are also not parallel, and the left is angled slightly laterally. The mild pelvic rotation and pelvic limb positioning are resulting in the right hip appearing to have decreased coverage of the femoral heads by the acetabular rims, as well as having subluxation of that right hip. On retake images, seen on the right, the ilial wings and obturator foramen are symmetric and well aligned. The pelvic limbs are parallel to one another. The patella remains slightly lateral in position, although improved from the prior image. We can see that this change in position has changed the appearance of that right hip, which now has good coverage of the femoral heads and no evidence of subluxation. This final example is of a patient with an L7 transitional vertebrae. The spinous processes are well aligned over the vertebral bodies on the image on the left. However, the obturator foramen and ilial wings are slightly asymmetric, with the right obturator foramen slightly larger than the left. The limbs are also not parallel, with medial angulation of the right pelvic limb. This patient is rotated slightly towards the left. The result is that there is absolutely no overlap of the left femoral head by the acetabular rim. On retake images seen on the right, the spinous processes are seen to the left of midline. However, the obturator foramen are more symmetric than on the previous study. The limbs are parallel to one another. While this particular dog does have significant pathology and arthritis of the hips, and this would not result in a change in this particular dog's grade, there is still a notable difference in the degree of coverage of the femoral heads by the acetabular rims. Dogs that are borderline, this could be the difference between being diagnosed with normal hips versus dysplastic hips. In conclusion, we can see how vital positioning is in being able to assess dogs properly for hip dysplasia. The OFA strives to provide representative grades to dogs so that breeders and owners may use that information to make informed decisions in breeding for healthier dogs. The best chance of doing this is to ensure that the radiographs submitted for evaluation have the most ideal positioning for each and every patient. If you have any questions or comments, please feel free to reach out to the OFA via email or phone. I would like to take a moment to thank the OFA for the use of their images and to thank you for listening. If you have enjoyed this webinar or would like to hear more on additional topics, please like, share, or comment below.